Hello and welcome. Let's talk about MRI. MRI means magnetic resonance imaging. The strengths, advantages or superiority of MRI over USG exterior CT scan are no ionizing radiation, excellent soft tissue contrast, best imaging technique for intracranial lesions, especially posterior fossa lesions, spine and bone marrow and joint lesion. Weakness includes absolute contraindications like ocular, magnetic, metallic foreign bodies, pacemakers, cochlear implants, and cranial aneurysm clips. Relative contraindications are first trimester of pregnancy and claustrophobia. And there is long scan time, so the patient may not be able to keep still, especially if the patient is in pain and it is limited availability. Evolving uses of MRI includes staging, MRCP, MR angiography, breast malignancy, pelvic malignancy, cardiac imaging. End of the topic.